Candida infections, also known as candidiasis, are among the most common fungal infections that affect humans. Candida is a type of yeast that naturally exists on the skin and inside the body, particularly in areas like the mouth, throat, gut, and vagina. Under normal circumstances, Candida lives harmlessly with other bacteria, playing a neutral or even beneficial role in maintaining the body's microbial balance. However, when certain conditions disrupt this balance, Candida can grow out of control, leading to an infection known as candidiasis. Candida albicans is the most common species responsible for infections, but other species like Candida glabrata and Candida tropicalis can also cause problems. Candidiasis can occur in various parts of the body, depending on where the overgrowth happens. These include oral candidiasis, called thrush, vaginal candidiasis, and more severe forms like invasive candidiasis, which affects the bloodstream and body organs. Candidiasis is so common that nearly everyone will experience at least one form of Candida infection in their lifetime. Types of candidiasis. Candidiasis can affect different parts of the body, leading to various types of infections. Number 1. Oral candidiasis. Oral candidiasis, commonly known as thrush, occurs when Candida overgrows in the mouth and throat. It often appears as creamy white or yellowish patches on the tongue, inner cheeks, gums, or the roof of the mouth. Number 2. Vaginal candidiasis. Vaginal candidiasis, often called a yeast infection, is one of the most common forms of candidiasis. It affects the vaginal area and causes symptoms such as itching, burning, irritation, swelling, and abnormal vaginal discharge. This type is particularly common in women during pregnancy, those who use hormonal contraceptives, or after taking antibiotics. Number 3. Cutaneous candidiasis. Cutaneous candidiasis occurs when Candida infects the skin. It commonly develops in warm, moist areas of the body, such as in the armpits, the groin, or between fingers and toes. This type of candidiasis presents as a red, itchy rash that may include small blisters or pustules. Number 4. Invasive candidiasis. Invasive candidiasis, also known as systemic candidiasis, is the most severe form of Candida infection. It occurs when the fungus enters the bloodstream and spreads to various organs like the liver, kidneys, heart, or brain. This form of candidiasis can lead to serious health complications, especially in individuals with weakened immune systems, such as those in intensive care units, receiving chemotherapy, or recovering from organ transplants. Causes of candidiasis. While Candida is naturally present in our bodies, certain factors can lead to overgrowth and subsequent infection. One of the most common causes is the use of antibiotics. While antibiotics help fight harmful bacteria, they can also kill the beneficial bacteria that keep Candida in check, allowing it to overgrow. Corticosteroids and immunosuppressive drugs used in treating conditions like asthma and autoimmune diseases can also suppress the immune system and make it less effective at keeping Candida growth in check. People with diabetes, especially those with poorly controlled blood sugar, are also more susceptible. High blood sugar levels can create an environment in which Candida thrives. Similarly, individuals with weakened immune systems, such as those with HIV or AIDS or undergoing chemotherapy, are at higher risk of developing candidiasis. Hormonal changes, such as those occurring during pregnancy, menstruation, or from the use of birth control pills, can also promote yeast overgrowth. In addition, poor hygiene and wearing tight, non-breathable clothing can create moisture and warmth, providing a perfect breeding ground for Candida, particularly in areas like the groin. Other than that, eating a diet high in sugar and refined carbohydrates can feed Candida, promoting its growth. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of candidiasis. The symptoms of candidiasis vary depending on the type of infection and the part of the body it affects. Here's a breakdown of the most common forms of candidiasis and their symptoms. Number 1. Oral candidiasis, thrush. Oral thrush is when the infection is in the mouth and throat. This type can cause white, creamy lesions on the tongue, inner cheeks, gums, and throat. People with oral thrush often describe a cotton-like feeling in their mouth and may experience a loss of taste. Swallowing may also become difficult, and in severe cases, the infection can spread to the esophagus, causing more serious complications. Number 2. Vaginal candidiasis. Vaginal yeast infections are characterized by itching, burning, and redness of the vagina and vulva. Women often experience a thick, white discharge that resembles cottage cheese. There may also be discomfort or pain during urination or sexual intercourse. Number 3. Cutaneous candidiasis. In cutaneous candidiasis, symptoms often include red, itchy rashes that may develop in skin folds, such as in the groin area, armpits, or between fingers and toes. These rashes can be accompanied by a burning sensation and, in severe cases, may develop blisters or pustules. Number 4. Invasive candidiasis. This form of Candida infection is the most serious and occurs when the fungus enters the bloodstream and spreads to various organs. Symptoms can include fever, chills, fatigue, and more severe organ-specific symptoms like kidney or liver dysfunction. Systemic candidiasis can be life-threatening and requires immediate medical attention. Diagnosis of candidiasis. For superficial infections like oral thrush or cutaneous candidiasis, your doctor may be able to make a diagnosis based on the appearance of the lesions and the patient's symptoms. In cases where visual examination is inconclusive, or for more serious infections, laboratory tests are necessary. For oral candidiasis, your doctor may scrape a small amount of the white patches from the mouth and examine them under a microscope to identify Candida. Vaginal yeast infections can be diagnosed by examining a sample of vaginal discharge under a microscope. A doctor will also check for other infections, as yeast infections can sometimes occur alongside bacterial infections. In cases of skin infections, your doctor might collect skin scrapings for examination. If systemic candidiasis is suspected, blood cultures and other specialized tests may be performed to detect Candida in the bloodstream or organs. Treatment for candidiasis. The treatment for Candida infections depends on the type and severity of the infection. For skin infections, topical antifungal medications are often effective. These may include creams, ointments, or suppositories containing drugs like miconazole, clotrimazole, or Nystatin. For oral thrush, antifungal mouthwashes or lozenges are commonly prescribed. In more severe cases, oral antifungal medications like fluconazole may be necessary. Vaginal yeast infections can be treated with over-the-counter antifungal creams or suppositories. In some cases, a single dose of an oral antifungal medication can resolve the infection. For more severe or invasive infections, systemic antifungal drugs are necessary. These are typically administered intravenously in a hospital setting. Drugs like amphotericin B, caspofungin, or voriconazole may be used, depending on the specific Candida species and the patient's overall health status. In addition to antifungal treatments, addressing underlying causes is crucial for effective treatment of Candida infections. This may involve controlling blood sugar levels in diabetic patients, adjusting medications that may be contributing to the infection, or treating underlying immune system disorders. Good hygiene practices are also essential, especially in warm, humid environments. This includes keeping skin clean and dry, changing out of wet swimwear or workout clothes promptly, and wearing breathable, moisture-wicking fabrics. For women, avoiding douches and scented feminine hygiene products can help maintain the natural balance of vaginal flora. Reducing intake of sugar and refined carbohydrates, which can feed Candida, may also be beneficial. Some people find that incorporating probiotic-rich foods or supplements helps maintain a healthy balance of microorganisms in the gut. Finally, when antibiotics are necessary, taking them as prescribed and completing the full course is important. Now, we want to hear from you. Have you ever experienced a Candida infection? What home remedies or treatments worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.